Welcome to Liberty and Justice for All. Tonight, I've said to you many times how delighted I am to do this show because I get to have my friends on and nobody gives me any crap about it. So tonight we have Dr. Ward Dean, medical director of vitamin research products right here in Carson City. I've talked to people all over the country who tell me they know of vitamin research products. Well, we have them right here. He's done the formulation for the oral chelation, which at that time, well, at this time too, I couldn't afford anything but oral chelation. And so with your advice, I did it for 4 years. Well, actually, I'm still doing it. It's been over 5 years now, 6 years. It's amazing. Actually, it's 6 years past the time that the doctors that had the scalpels and the deposit slip in their hand told me I would die. What I learned from Dr. Dean, not just Dr. Dean, but he was very instrumental in it, and many other people, there was no magic bullet. It wasn't just chelation. It was a lifestyle change which I made along with just about everything. So I really thank you for what you did, and I thank you now for what you do, because you're still doing it. Vitamin research products, and the 800 number will be on here. Not necessary to buy something. This is not a sales pitch. It's because they put out a newsletter every single month that is full of information, and it's free, isn't it?
It is.
It's free, and it's amazing. Every month I've been getting this, and they have a catalog, and their catalog is actually informative. It isn't a list of things.
Now, this is a catalog you want to sit down and read because it's really packed with information, because we want our customers to understand how to use our products.
The words operation. Just like I didn't have a heart attack, I had an event. When I was home, I had a heart attack. I knew it, I felt it. When I got to the hospital, they said you had an event. All right, I don't care what you call it. But the most amazing part to me is when they came in and said, you are scheduled tomorrow afternoon for this procedure. And I asked them to explain what the procedure was, and we got into a hassle. But when I said no, and that's exactly what I said, and it is no, very simple. I said, you're not going to cut on me. I was in intensive care. I had wires and gadgets and beepers and lights and my own nurse, and I mean, this was like fantastic. Within 4 hours, I was out of intensive care, unhooked, downstairs in the Vietnam Veterans Ward. I was in the VA hospital. The terminally nutty Vietnam veterans that they were sure were never going to, you know. Now, if I was that sick upstairs, why, after saying no, was I down? Shouldn't they learn and not just go into the doctor and say, I have a pain over here, give me something?
Well, doctors are under tremendous pressure these days. Number one, from their peers. They've got government agencies looking over their shoulders, and they've got their professional groups looking over their shoulders, and they've got certain guidelines that they have to follow. And since they're taking government money or insurance company money in most cases, they really have to practice medicine the way the government or the insurance companies want them to practice. And it's the rare physician who is not accepting insurance who can really, I believe, have the patient's best interest at heart, because he's not working for the government or working for the insurance company. He's working for that patient. Think about it. And people ask me why I don't have medical insurance. And even if I was not a physician, I probably wouldn't have it, because you have to ask yourself, do I want the kind of medical care that that this insurance would provide for me? And in most cases, it's not. About the only condition for which you think you might really need it would be some terrible catastrophe, an accident, and in those cases, the hospitals, they're required by the government to take care of you anyway.
At the hospital, I had studied a lot about chelation, and chelation, oxygen therapy, a whole bunch of things. But chelation was primary in my mind. And I went to a doctor here in town, and I talked to you, and basically intravenous chelation was $6,000, roughly, to basically clean me out. So I went back to the VA, who was willing, and it's still in my file to this day. To this day, I can walk into the hospital and get bypass surgery. Doesn't matter how healthy you are, but they were willing to pay $125,000 for bypass surgery. And I said, I'll make you a deal. Pay the $6,000 for chelation. If it doesn't work, then take it off the $125,000 after you cut me open. It was down at that time. I'm the patient. I don't know, but I have some common sense. The doctor had just given me a brochure that said I had 60,000 miles of veins and arteries and capillaries in my body. And it was a brochure they gave me and told me all this stuff. And I looked up at him and I said, you just told me I got 60,000 miles of this stuff in my body. You're going to replace, well, first of all, you're going to rip a vein or an artery out of my leg, rename
they're going to pull a vein out.
Pull a vein.
Which is structurally different than an artery, and they expect this vein, which they're going to use to patch over where the artery is plugged, to do the job that artery can do. And a vein is not structurally strong enough to really do that job. Treating it surgically is like putting a Band-Aid on a major surgical wound, because if you've got a systemic problem, you need to treat it systemically. And the best way to do this is biochemically with a substance like EDTA, whether it's administered intravenously or even orally. And we're getting more and more information now about oral chelation, that it is as effective, or it may be even more effective in some ways than the intravenous treatment, which many of us physicians continue to administer. And a lot of us recommend both the intravenous and in the intervening periods to use the oral EDTA. Chronic degenerative diseases, arthritis, hypertension, diabetes, atherosclerosis, the diseases that you can't treat with 1 or 2 pills for a short course of treatment. And orthodox medicine is terrible at treating chronic degenerative diseases. And that's where the alternative physicians and companies like Vitamin Research really excel, because we teach the people, number one, what the causes of the problem are, and then what can they do to prevent it and to treat it.